What should the government be doing to fight the opioid epidemic? In this episode, I'm joined by Congresswoman Brittany Pettersen. Her career in Colorado politics started as a member of the Colorado House, then as a state senator in Colorado, and today she's serving nationally as the representative for Colorado's 7th Congressional District. She is also someone whose entire life has been shaped by the opioid epidemic. From a young age, her mother struggled with addiction to opioids, and she's become one of the leading voices on this issue, both in Colorado and now nationally in the House of Representatives. She joins the show today to talk about her personal story with family addiction, how we get treatment in the hands of the people who need it, how we step up enforcement to stop drugs like fentanyl at the border, how we prevent overprescription of opioids from legal channels, and much more. If you enjoy this podcast, please consider supporting the Center for New Liberalism. You can become a member of the Center for New Liberalism at cnliberalism.org/become a member. Thank you all for your support, and enjoy the episode. Welcome, everyone, to another episode of the New Liberal Podcast. I'm your host, Jeremiah Johnson, and joining us this episode from Colorado's 7th Congressional District is Representative Brittany Pettersen. Congresswoman, welcome to the show.
Thank you. It's so wonderful to be with you. Thank you for having me here.
So we'll start things off. I want to note, you've been very open for years now about your own family's struggles with opioid addiction. And that seems really important to do because, even though it's very tough to talk about, I'm sure, one thing that gets lost in policy discussion sometimes is that we're not just talking about something abstract. We're not talking about just, this is a number on a page in a report. This is real people that these issues are affecting. The opioid crisis is happening to real people, real families all across the country. So with that in mind, can you tell us about your life growing up, your home, and your mom, and how you got introduced, unfortunately, to this issue?
Yeah, thanks, Jeremiah. I think you hit it spot on. It's so important that we all tell our stories, whether we've struggled ourselves or we have people in our life, our family members, our loved ones who have struggled with addiction. One of the greatest barriers that we face to ensure that we are able to increase access to treatment and get people the help that they need is the stigma that people continue to face around addiction. It is absolutely the number one barrier that we face. So it's important that we tell our stories. When I was first running for office, I did not talk about where I came from. I talked about being a high-risk youth. I didn't talk about what that meant. And there was a point at which I felt it was incumbent upon me as a state representative, just seeing firsthand the failed policies, that I finally would tell my story. And it was scary. It's common to feel a lot of shame coming from a background like mine. And not just, in politics, but in general, children who grow up with addiction, you grow up feeling a lot of shame from where you come from. And so it was difficult to actually acknowledge and tell my story. But it was absolutely essential when I wanted to build trust with my colleagues on my knowledge and my personal experience and what we need to do to solve it. So it really did help bring people to the table, bring empathy and understanding. And so many people who I've met along the way have told me how much it's helped them with their own issues, or thinking, a little girl telling me that, her mom struggled with addiction, and seeing me succeed and be in Congress, that she thinks that she can also follow her dreams. So my process, that was a long introduction, but my journey started when I was just 6 years old. My mom, we had a normal, or I guess regular family. No one has a normal family. And So when I was just 6 years old, my mom fell and hurt her back. She went from having a back injury to ultimately, she went to the doctors, came home with bottles and bottles of opioids. And after her back injury healed, she found herself being wildly addicted to opioids. And her story is so similar to so many people's stories in the United States of having an injury, going to the doctor, taking the prescription that your doctor has given you to get better, and then being physically addicted without the understanding of it, without any access to treatment or recovery services. And in fact, what we do and have done in the United States is we shame people. People who are struggling with addiction are not given the support and the treatment that they need, but even worse, they are shamed and told that they're wrong and that they're not worthy and this is their fault. And it's a brain disease. And so I didn't know that growing up. I thought it was my mom didn't love us, so she was choosing this over us. So it was very difficult to go through that without having the knowledge I wish that I had then. But it really wasn't until, we went through decades-long struggles there with my mom getting cut off of her prescription without access to treatment. And like so many people, she did what people who are addicted do who don't have the medical support that they need. They go to doing whatever they can to avoid withdrawal. So my mom turned to using heroin to fill that void and making sure that she was staying well. She always said that you fear withdrawal more than you fear death because of how terrible it is to go through and what that's like when you're addicted. And unfortunately, fentanyl started coming into the supply chain in 2016 in Colorado. First, it hit the East Coast and the West Coast, and it started making its way in. Now it's completely taken over the supply chain across the country. And when it started showing up, my mom started overdosing at a very high rate because it is much more potent in what you're actually putting in your body. And so it can be lethal. That year, my mom overdosed 20 times in 1 year. It was just a constant. It was one of the hardest years because she was in and out of hospitals. And this is when my mom started begging for help with nowhere to go. And that was, she finally said the words I waited my entire life to hear, which is that she didn't want to do this anymore and she wanted help. And I was a state representative at the time, and I could not find any place that would take her. We didn't cover treatment with Medicaid. The wait lists were long. The lack of information and understanding of the continuum of care, there was just, our system was absolutely broken. And the last day that my mom, she was waiting for months just to get in for 3 days of detox. And the day that she was supposed to go in for that, instead, she went across the street to the ER because she had overdosed and was found not breathing. My mom was revived. She was in the hospital for 11 days in the ICU. And the state of Colorado and the federal government spent almost $400,000 just that one visit alone to keep her alive in the hospital while denying the coverage and care that she absolutely needed to stay alive and be well and recover. So this is when I started, as a policymaker, just not only is it morally wrong, it's you're lighting money on fire and setting people up to die. And it makes no sense, no matter how you look at it. These are failed policies every step of the way. So I decided to tell my story, to lead on this issue because there is such a huge gap in understanding with advocacy in this space. This is not an area, you're not going to have lobbyists coming with solutions on this. This is not something that people make money on. These are the issues that are impacting so many people throughout our community that they need they need a voice, somebody who understands the issues that they're facing and the policies that need to change. So I focused on this at the state house. And then I ran for the state senate. So I spent 7 years working on this issue. And I said at the time, this is not a 1-year thing. This is a 5, 10, and 15-year focus area where we need to have the resources and dedication to address this issue. Unfortunately, at the state level, you're limited in changing systems that can really build the capacity nationwide, but you're also limited with how many people you can actually help because it's only one state and this is a nationwide problem.
Mm-hmm. I would actually love to ask you about that. It's great that you said that because that's like the next thing on my list is, you have worked at various levels of government, right? You've been in both the Colorado House of Representatives and the Colorado State Senate. Obviously, now you're in the People's House nationally in Congress. And I know that in Colorado, you helped pass a bill that expanded Medicaid coverage for like substance abuse treatment. And certainly at the federal level, you are sponsoring or co-sponsoring several bills. And I want to ask about how do these different levels interact in terms of working at policy on the state level, working at policy on the federal level, even on an international level? You can think about, you've talked about needing to pressure China to stop fentanyl from coming in. Certainly drug cartels in Mexico and other parts of Latin America may be part of this. How do those different levers of policy interact? Do you have a sense of which ones are like the most important and what we really need to be focusing on?
All of them are very important, but the greatest opportunity that I have to make an impact in this critical need area, we know more people have died from the opioid epidemic than all of the world wars combined. This should be one of our top priorities, but it's not because stigma is the greatest barriers that people face to actually getting the support that they need. And so the opportunity that we have at the federal level is that you can change systems and build capacity. And what that means in a focus area for me and what I found out when I was advocating for my mom is that Medicaid does not cover detox, treatment, or recovery services. I could not believe that my mom was dying, getting churned in and out of the ICU. We've spent over $1 million as a country and state keeping her alive and turning her away from the care that she needed. And that her condition was not treated as a medical condition. It wasn't supported with funding the medical support that she needed. And so in my fight to save my mom's life, I was able to get her the care that she needed because I was privileged as a state representative and I had access to some of the leading experts in the state. And most people do not have that. I had to get a court order. She went into treatment and finally got the help that she needed. And she just celebrated 6 years in recovery. And so my mom's life.
Congratulations, by the way. That's incredible.
Yeah, she's in it. Thank you so much. If my mom can go from overdosing 20 times in 1 year, 3 times the last day that she was in the hospital, to living in recovery, having a job, giving back to the community, being a part of our lives, she is an example of what's possible for everyone when we treat this as the medical condition that it is. So at the federal level, we can take what we've done in Colorado with covering treatment and recovery services through Medicaid. Well, actually, we cover inpatient and residential treatment through Medicaid, and we had to go through a long process for waiver. This is time-consuming, difficult, and we need to bring in incentives for states to take advantage of these benefits early on. So we're working on a bill that would actually help at the national level for any state to opt in with a 95% reimbursement rate for 5 years for services or for the medical costs, and then it would reduce down to what it currently is at is an 80% reimbursement rate at the federal level. So you can incentivize states to actually opt in to make sure that they're benefiting and that we're actually addressing the treatment that is necessary at the state level. what this does is it builds capacity and it's sustainable funding that really changes the landscape in communities. So the reason why my mom, was nowhere for her to go to get treatment is because we didn't have that funding stream and those priorities. It was incredibly limited. And even though many people struggle with addiction at every income level, you have a higher percentage of people who are on Medicaid who struggle with addiction because of the impact to people's income when they're struggling with this disease. And so when we change the way that Medicaid funds these services and priorities, we really can change the system. It's also about parity in funding. So we have, behavioral health services are always underfunded relative to physical needs. And we have a parity law, but it's on a complaint-based system. And we really need to change the system, which Biden did make some big steps in the proposed rules there. But on preventative measures like mental health care and then treatment and recovery services. So that's a big priority for me. It's not just my family was also impacted by my brother died from suicide. And so I've seen the mental health side of the failures on that side, and then on the substance use disorder side as well.
I think it's such a valuable point that we're often, what's the saying, penny wise, pound foolish, in terms of, not funding things that would ultimately save us a lot of money in the long run. But I do want to ask, a lot of what we're talking about right here is kind of funding and treatment based. But there's two approaches to this that I've seen people talk about. One of them is the treatment side, that we need to get people the help they need. But the other is the enforcement side, that we should be, cracking down on the drugs that are coming in. And, it's kind of preventing the addictions before they can happen, I guess, would be the philosophy there. Can you talk a little bit about what as far as policy on the enforcement side and what steps we need to take there? And maybe, is one of these more important, or do we just really need to go all out on both of them?
Yeah, you're absolutely right. This is complicated. And this is why I get frustrated with policymakers, because really tough issues like this that are incredibly complicated in addressing, and it takes, every single level and thinking through this strategically and in a comprehensive way. It's people don't have the bandwidth to even, it's hard to get people to care and focus on comprehensive plans. But what it takes, it is addressing the fentanyl, the precursors that China is sending to Mexico. Fentanyl is coming in through our ports. Unfortunately, the rhetoric on the right, it talks a lot about the border, but that is just not the case. 90% of fentanyl is coming through our ports. So we made significant investments in the previous Congress on the bipartisan infrastructure law that is going to modernize our port system and security and screening process. This is a huge step forward. But we also need to increase access to those technologies that can streamline the process at the border and identify things like fentanyl that has such a tiny amount that can be trafficked in and wreak havoc for communities. So we need to modernize our system also at the border, and we need to ensure that we're utilizing the tools that we have to put pressure on China. So it's going after that on the, with fentanyl coming into our supply chain. But we unfortunately have set our country up, even though this is happening across the world. This is the number one drug of choice for cartels because it's easy to traffic, it's cheap, and it's potent. But in the United States, we have created a situation where we are ripe for abuse here and in a market for the cartels because we continue to overprescribe. It wasn't just happening in the 80s and 90s. It is still happening today. It is the overprescription of opioids and people becoming addicted and ultimately turning to whatever they need to fill that void, like my mom, to avoid withdrawal, which is getting drugs on the street. So it's it's hitting it at every level. It's making sure that we're focused on the cartels, not criminalizing people for simple possession who are struggling with addiction. When you throw people in jail and don't give them access to treatment, you're literally setting them up to leave and die. It is when they are 900% more likely to die of an overdose when they're leaving jails.
And this is something I actually also wanted to ask you about. You keep leading me into wonderful transitions here, in that a lot of people want to tackle this. Obviously, it's a huge thing. I think you cited the statistic of how many hundreds of thousands of people have died from this, more than the world wars for America. But another thing that people don't want to do is go back to kind of the old days of the war on drugs, which is widely seen as a failure. And we threw a bunch of people in jail and in prison. And now we've got one of the largest prison populations in the world, or probably the largest, I think may be the case. And there's a lot of people who are just very wary of repeating the mistakes that were made during the war on drugs. So what would you say to those people who certainly want the opioid crisis to end and who want to make progress on this, but who don't want to, create another war on drugs and repeat the mistakes we've made before?
Well, I think that they're spot on. It's exactly the focus. We should not go back to the failed policies of the past that criminalize people struggling with addiction and focus on the drug traffickers. And we can do all of that through, I'm on financial services and I'm on the National Security Subcommittee, and we look at the ways that being able to identify the traffickers who are utilizing our financial system to operate, and how we can identify them early, shut them down. So it's about that. It's about the pressure on China. It's about security at our ports and at the border and upgrading there. And then it's about making sure that we're investing in the coordination at the local, state, and federal level with law enforcement for drug traffickers. It's really putting the focus on the people who are who unfortunately are devastating our communities and exploiting our communities. And it's also this is another piece, a very important piece, which what we've seen with the mass distribution of fentanyl is that people are getting it on Snapchat. And so they have an opportunity to, and then, using the pair-to-pair platforms where you're seeing young people get it on Snapchat, think that they're getting oxycodone or something else, and unfortunately dying of fentanyl poisoning. But then you're also seeing people who are addicted to fentanyl easily getting this through our social media platforms. And so we have a bill to do the first step in a study on what it would look like to regulate some of these platforms. But it's not like that Snapchat and others want this to be distributed on their platforms, but they have to actually come to the table on recommendations on how we're going to address this. And it's also looking at the ways in which they're transferring those dollars as well.
Another piece that you've mentioned is the legal market for drugs that unfortunately got out of control and is, one of the real root causes of this. Because if we're being honest with ourselves, nobody wakes up in the morning and says, man, I'd really just love to become addicted to fentanyl today. That's on my list of to-dos. But what happens, as in the case in your family, is that there was a lot of overprescription and still continues to be a lot of overprescription of opioids, and that transitions into the illegal market. So, we've been talking a lot about the illegal market and illegal products like heroin and fentanyl, but what role is there for kind of fixing the overprescription of legal drugs, of legal opioids that people genuinely need in many cases, but that are not being handled responsibly? How do we fix that problem? Because that seems really sticky to me.
Oh, yes. There are so many things that we need to do on that level. I was talking to someone yesterday who works on this issue, and I voiced my frustration around, it feels like we've just accepted that this is the system that we have, and the consequences that come with that. And that's just unacceptable. It is we are pulling people into the cycle of addiction because we aren't, we don't ensure that doctors are actually taught about addiction. It's actually a small piece of their education unless they're in the specialty, and some of that that is overseen at the state level. We brought a continuing education mandate, and then through rulemaking it got completely watered down. So it's a long process to actually go through this, but doctors should have to learn about addiction. There should also be, you can use pressure around report cards. So we have a grant that was funded at the federal level that states could take advantage of around report cards where you'd send it to the doctors and they would be notified if they were overprescribing relative to their peers in the same area. But that's not enough. We have to have requirements for the use of the PDMP, so you're actually reporting prescriptions, and then there's accountability if you aren't. And then we need accountability if you are overprescribing. As a doctor, we need to have repercussions and follow-ups and procedures there. So this is incredibly, we have a lot of work to do to undo the people who have been trained to overprescribe, and we need to ensure that the new doctors who are going through, who are in our education system, are actually getting the critical training that they need.
We've been talking about a lot of kind of the well-known policy levers in terms of overprescribing of legal opioids, in terms of controlling illegal drugs coming in at the border, in terms of kind of international versus national versus state. I wonder, though, are there any policy levers that we haven't talked about so far that you think are going to be important? Potentially, this could be, new drugs that could be helpful in combating this, or just new policy ideas that are more than just, well, let's toss a bunch of money at people so that they can get treatment. Not that that's a bad idea, but I'm curious if there's, from your position as someone who's been studying this for years, if there are things you wish got more attention as ideas to kind of help mitigate the catastrophe that we're going through with the opioid epidemic.
Well, I think that there's some new, there's a drug that has been discovered to reduce cravings for people who are struggling with addiction. It's really exciting. There are opportunities for new drugs to come on the market to address to help with the brain disease that of addiction. But it's, I think, back to the fundamentals. We need to make sure that we bring parity in our laws for behavioral health services and work on prevention, making sure that we work on addressing the drug traffickers and the influx there, and then increasing access to treatment and recovery services. And most importantly, we need an education, public awareness campaign around addiction and reducing the stigma, telling stories, and getting people the help and support that they need. My mom, like I said, she's just celebrated 6 years in recovery and is an example of what's possible. We are losing so many lives unnecessarily because of the lack of focus and caring about this critical issue for our country that has impacted all of us, and it's because of the stigma. So let's tell our stories. Let's continue to support candidates who are going to prioritize these things. I think it's very rare for somebody to be in Congress who has a mom who struggles with a heroin addiction, and I feel the weight of being here and what that means to be a voice for the people who are always left behind. And so for those that are listening who have struggled themselves, you're not alone. And for the people who have loved ones who are going through this, there is hope. It's just making sure that they get the right support and the medical support that they need.
I know we're coming up on time soon, so I want to ask the traditional final question that we ask everyone who comes on the show, and that is, where can people go if they want to learn more? If they're interested in what we're talking about, if they're interested in helping combat the opioid epidemic and in learning about this, what would you point them to as far as resources? And this could be bills that are currently underway, maybe going to be passed in Congress. This could be books to read, people to follow on Twitter who are knowledgeable about this. Anything at all that you think would be helpful for people who are eager to learn more about this?
Well, I think that this is part of the problem is that the information is so siloed around these issues. And so I brought a bill and worked on trying to making sure that the 988 number was somewhere that you could call to not just get, for suicide prevention, but also for behavioral health services, for substance use disorder, treatment and connections there, as well as a platform where you could go to actually identify in your area what services are available, and trying to bring, that just most people don't even know where to begin. So what I would say is that your members of Congress are supposed to be there to be your advocate. If we are doing our job, and I can tell you our office is, it is about connecting you to the support that you need and trying to help navigate to make sure that our system works for you and be an advocate for you. So you can always reach out to my office. This is something that is a huge priority for me. As you know, it is pettersen.house.gov. And you can reach out to our team if you want to just take the first step to better understand, where to go for somebody that's struggling, or how to get in, how to be engaged on these issues, and the things that we're working on. We can keep you updated. But I want you to know that our team is here to support you. And also, every member of Congress should be doing this work as well.
That's fantastic advice. And, as we close, I just want to say it's always one of my favorite things when we get the chance to talk to elected officials. There's so much noise out there that's all about the culture war stuff and the big national issues where it's Democrats and Republicans screaming at each other. And sure, there's a place for that. They're important issues. But I really love being able to talk about things that are not red team versus blue team necessarily, that are just stuff that, we need to work at, that a particular member of Congress has a particular passion for. It's really a treat for me to be able to talk about this. And this feels like something we can actually make real progress on, and it doesn't have to divide us. It can be something that we all can push for in the same direction. So with that in mind, I want to say thank you so much, Representative Brittany Pettersen, for coming on the show today.
Thank you so much, Jeremiah, for having me. And thank you for caring about this issue. I couldn't agree more. It's the issues like this that are doing the real work that we were elected to do that inspire me every day to keep going, and not the infighting and the partisanship that you see at the national level. I always say, somebody said that I can't wait to see you on, this national show. And I said, well, that's probably unlikely because I don't say crazy things. There is a lot of noise. We don't, the people like me who are rolling up their sleeves doing the important work that's necessary are not the ones that are going to always make the news. And thank you for highlighting the great work that we are doing and needs to be done. Because I can tell you that there's a lot more of us focusing on the real issues here.
Well, it's been a pleasure to have you, and we look forward to seeing what you are working on in the future.